we have some good news to report this morning from the world of cancer treatment and research. A new study says that cancer-related deaths have fallen 26% since 1991. That means right now, there are nearly 2.5 million people alive, thanks to breakthroughs in cancer research and in cancer treatment. So what are some of the factors leading to the success in the fight against the disease? Joining us with a look at that is Dr. Shawn Whatley. He's the president of the Ontario Medical Association. Good to have you here.
Thank you.
All right, first of all, how much of this success is attributed to our being more aware and us changing our lifestyle?
Well, I think probably a huge part is attributable to what we're doing. So a lot of people know that smoking causes cancer and you shouldn't smoke. But not just that, I think there's great research now around exercise, diet, getting to see your family doctor if you've had a risk of cancer in your family. So people are much more aware than they were before.
Employers are also more aware and making changes for the people who work for them.
Absolutely, absolutely. So occupational hazards for cancer, for example, wood dust in a worker's nose or soot if you're working around it, asbestos in the workplace, much more on people's radar now.
The really exciting piece of information for me from this is the technological advancements that have been made. Give us an idea of what some of those are.
Oh, it's a huge, huge field. So right here in Toronto, Sick Kids is doing research now to tailor-make therapy for a particular cancer that children have. So instead of using a shotgun approach where we give a whole bunch of drugs, hoping that one of them is going to work, we're going to really focus in on what a particular tumor is going to respond to. And that's right here in Toronto.
Something to be really proud of. You know, the most common cancers for men and women, breast cancer and prostate cancer, they've seen incredible results in terms of, people living longer lives. But lung cancer remains the #1 cancer killer still.
Yeah.
So not a lot of change in our lifestyle, although more awareness. But is there a danger that with good news like what we're talking about now, people can become complacent?
So great question. On the one hand, I want you to be a little bit stressed about cancer, even though we have this good news out there. It's kind of like wearing seatbelts. We know seatbelts save lives, but hopefully you'll never be in a car crash and need one. It's the same thing with cancer. We hope that you'll never ever get a cancer, but we need you to get in there, get screened, get your mammogram, get your, your pap smear and your colon cancer screening, and a lot of this can be prevented.
And the #1 way to prevent it is just getting checked.
Getting checked, absolutely.
All right, where do you think we'll be in another 10 years?
So this is some really exciting research. I think genomics and looking at how your particular genetic makeup increases your risk or gives you, puts you at particular risk for certain kinds of cancer is changing the way we look at cancer in patients. The way we diagnose cancers as well, looking at liquid biopsies instead of just relying on CAT scans and MRIs, will change the face of the way we look at cancer treatment and diagnosis in the next 10 years.
I understand treatment, but how would it change your diagnosis?
Well, liquid biopsies actually is another Canadian research. It's from New Brunswick actually, where instead of having to get a CAT scan, you just get a blood test, and on the blood test, they can find exosomes that are little packets of information that are released from cancer cells. And then they could say, oh, you have an increased risk for bowel cancer or for breast cancer. And they're hoping that in the next few years we'll be at a point where you can actually diagnose someone with cancer before you actually see it on a CAT scan.
Incredible. Good to have you here to talk this over today.
Thank you so much.